Look, if you were listening to the Brisbane Gold Coast game on Saturday night, you might have heard some talk about co-captain Lachie Neale, who's injured, spending a lot of time in a hyperbaric chamber to help heal his leg in the hopes he can play in the grand final. But how does that work? How would high pressure help his leg recover? And how much time would he have to actually spend in that chamber for it to work? So we're going to break down the science. Associate Professor Susanna Sherlock is the Wesley Hyperbaric Medical Director. And Professor, good evening.
Good evening, Kelly. Thanks for having me on the show.
Firstly, how do hyperbaric chambers work?
Well, hyperbaric chambers have been around for a long time, and they work simply by pushing compressed air into the chamber, which is the size of a room, and then delivering oxygen in that pressurised compartment. So you get a really massive dose of oxygen into the body of the individual that's in the chamber.
What's the difference between a medical hyperbaric chamber and a therapeutic one?
Well, I would say a medical hyperbaric chamber is a therapeutic one.
Yep.
I suppose there is a standard. There are Australian standards for the delivery of hyperbaric oxygen as a medical and therapeutic thing, which is certain standards of the care, the training of the people that are delivering it, so medical and nursing training and technical training for the people running the chamber. So there's very specific Australian standards, and if you meet those standards, then you can train doctors and nurses in that specialty, and you can also receive Medicare rebates from Medicare because it's accepted that it's a proper medical facility. Then there's lots of other people that purport to give hyperbaric, but it's not at the same therapeutic necessarily grade medical hyperbaric treatment. So these are the wellness centres and gyms and that sort of thing. So I think the difference is if you know that the person giving you hyperbaric oxygen abides by the Australian standards for delivery, then you can be fairly confident that you're getting proper medical grade hyperbaric.
Yeah. Okay, so you've got an injury, you go into a hyperbaric chamber. What does the high pressure do to help the healing process?
Well, it's the 100% oxygen under high pressure. It's not just the pressure itself. So and that's one of the things, a lot of wellness centres deliver air under high pressure. That's not the same as delivering 100% oxygen. So what it does is it reduces bubble size in people who've got decompression illness, divers. Many people understand decompression sickness and hyperbaric chambers for that.
Yeah.
In the setting of radiation injury, which is the next biggest group of people that we treat, it delivers oxygen to create new blood vessels in areas where cancer patients have had radiation treatment, which has caused scarring and tissue damage around the cancer. So that's the next biggest group. And then the other big group is people that don't have enough oxygen flow. So there would be the people like diabetics or people who have had complex surgeries where they have poor blood flow around the surgical thing, such as people who've had complex plastic surgical flaps to cover areas where they've had tissue deficit and they've now got a complex flap. For the biggest example would be people maybe post-mastectomy, where you have reconstructive surgery around the site.
Is there, Professor, evidence that it does work for sport injuries?
Well, it's a little bit more controversial in sports injuries. There was a review article published just this year in the Turkish journal Sports Medicine, which looked at the material that's been published. And frankly, there's been very small numbers of studies with very small numbers of patients with lots of different protocols. And so it's really hard to establish an efficacy. However, having said that, there have been some very good rat experiments that have shown good efficacy, because when you give a rat with an injury, hyperbaric, compared to a rat with the same injury that doesn't get it, and then you sacrifice the rat and you have a look at the injury and see which one's healed better, the rats that got hyperbaric healed better. But you can't do that with human beings, and we don't have the evidence. However, obviously in elite sports, where there's a lot at play, and somebody has an injury and they're desperate to get back into the field, then there has been a large movement, and a lot of professional sports people do use it. And in fact, a lot of professionals in horse racing use it. So there's a lot of big business in equine, horse animal veterinary clinics. So there's a lot of money spent around the world with getting racehorses who have minor injuries back onto the race course using hyperbaric oxygen.
That's going to be a big hyperbaric chamber that has a horse in it.
Yes, some of the best hyperbaric chambers in the world have been made and are funded by very wealthy people that have a lot of interest in racing. So, yes, some of them are pretty wealthy people.
I bet. Some of the wealthiest people in the world, I would imagine, who love their horse racing. Yeah. So what's the process of getting into and out of the chamber? Seeing as you were talking about those, for example, who were decompressing, diving, is it the same when you haven't had that sort of injury?
Yeah, because they're all treated at the same time, maybe just on a different treatment protocol. But essentially, in a medical hyperbaric chamber, it's normally like the size of a room, and it's like steel framed, reinforced with big steel doors, and large windows that are like 9 inches thick that keep the pressure in. And once the patient, we pressurize the chamber by pumping air in to make it compressed, and then the patient puts on a helmet that's made out of plastic, a bit like a space helmet, where they get the 100% oxygen, and that's for safety, so that the 100% oxygen is just in the helmet rather than the big chamber, to reduce the risk of fire and explosion. And of course, some of the injuries that have happened around the world have been to do with that, where people have taken not the same level, they haven't kept to the standards that you need to be to keep it nice and safe.
Yeah. Can you take in a book? I imagine technology is tricky in a 100% oxygen environment, but a book okay?
Yeah, so you can take a book in. So our chamber at the Wesley, you can take a book in. Some chambers around the world have, you can even have TV screens, but they're specially modified so that all the electronics in the TV screen they have nitrogen in the electrical circuits instead of air, to completely take away the risk of a fire or a static charge. All the patients get changed into cotton materials, and they put on special anti-static socks so that the patients have no static build-up on them. And when you're putting a patient into what we call a monoplace chamber, which is like one of those tubes that you slide into, then you take even extra precautions, and the patient has a grounding bracelet that grounds them so that there's absolutely no ability to have a static charge on them, because obviously a static charge in a highly combustible environment would be very bad.
It's not what you want at all. So given that there's so little evidence or research in this area in terms of sporting injury, is there sort of a limit on how long you can be in there safely?
Well, I guess the oxygen dose safely, we have specific protocols that people run to. So it's nearly always 90 minutes for a standard protocol treatment for what we treat other things for, the other medical things. So there's no difference when we go to a sporting injury. If we were to do that, you just go by the safe standard treatment therapy. So that's generally 90 minutes at 14 metres. So the medical standard is 2 to 2.4 atmospheres. So that's 10 to 14 metres seawater depth equivalent pressure.
Wow.
So that's pretty much what everybody gets treated, because that's the standard proven safe treatment. And the main side effects are those to do with middle ear pressure changes. So anyone who's been on an aircraft with a cold would know that it's very uncomfortable coming down on descent because they're unable to equalise the ears. So in the chamber, 1 in 10 people would have difficulty equalising their ears until they get used to the techniques that are needed to equalise.
Yep.
That's the most common side effect.
All righty. Any other risks associated with use of a hyperbaric chamber?
Yep. When it's a medical chamber and you're giving 100% oxygen at depth, you have the risk of oxygen toxicity, because that can happen, and that can create seizures. So this is not a therapy that is without any side effects. 1 in 220 odd patients would have a seizure associated with their treatment, which is why it's important to be done in a medical facility. And that's maybe the difference between a lot of wellness centre type ones. They don't give the same oxygen dose, so they don't normally have that risk because they're not giving the same treatment dose that is considered by Medicare to be therapeutic.
Yeah. I've learned so much tonight about hyperbaric chambers. Associate Professor Susanna Sherlock, really appreciate your time.
Thanks very much for having me.
There we go. And the Associate Professor is the Wesley Hyperbaric Medical Director.